All right, everyone, welcome. Today, we are putting on our detective hats and diving deep into the microscopic world of red blood cell pathology. Being able to analyze these abnormalities on a blood smear is such a core diagnostic skill, so we're going to break it all down together. Just think about that for a second. What secrets are hiding in a single drop of blood? A peripheral blood smear isn't just a bunch of cells on a slide. It's a rich, detailed story about your patient's health. And our job is to learn how to read that story.
And this right here, this is the most important idea for our entire discussion today. I want you to think of yourself as a clinical detective. Every misshapen cell, every weird little thing you see inside one of them, it's a clue. And by piecing these clues together, we can solve the case and figure out the diagnosis.
So here's our game plan. We'll start with our detective's guide to blood. Then we'll look at clues in the cell's shape and the evidence we can find inside the cell. After that, we'll see how it all comes together to build a diagnosis, and we'll finish up with a high-yield briefing to make sure all the key facts stick. Ready? Let's open the case file. Okay, so in this first part, we're really just setting the stage. Interpreting a smear is kind of like learning a new language. You have to understand the basic grammar and vocabulary before you can really understand the complex stories the cells are trying to tell you.
So, our investigation is going to kick off with the most obvious piece of evidence, the shape of the cells. Morphology, which is just the study of their form and structure, is our first and honestly one of our most powerful tools. Let's see what these shapes are telling us. First up, we've got two cells that trip people up all the time, the acanthocyte and the echinocyte. Now the key difference? The thing you really need to focus on is the projections. Acanthocytes, or spur cells, have these irregular, totally uneven, spiky projections. Think of them as angry, jagged cells. Echinocytes, or burr cells, are much more orderly. Their projections are small, uniform, and evenly spaced. Both can show up in liver disease, which is tricky, but their distinct shapes tell a slightly different story. Next up, we have dacryozachromyocytes, better known as teardrop cells. And the name really tells you everything you need to know. The story here is that these poor red blood cells are being physically squeezed out of an overcrowded bone marrow, maybe from something like myelofibrosis. A really simple way to remember it: the red blood cell sheds a tear as it gets forced out of its home. Okay, everybody listen up, because this one is absolutely critical. Schistocytes are a major red flag. These cells aren't just misshapen, they are literally fragmented, torn apart pieces of red blood cells. This happens when they get ripped to shreds trying to pass through damaged small blood vessels or past something like a mechanical heart valve. If you see these, your brain should immediately scream TTP, HUS, DIC. These are a true medical emergency on a blood smear. Now for the fascinating life story of a degemnocyte, or as we all love to call it, a bite cell. It all starts with oxidative stress, and the classic example is in a patient with G6PD deficiency. This stress causes the hemoglobin to denature and form these little clumps inside the cell called Heinz bodies. Then, as that cell makes its way through the spleen, a supervigilant macrophage spots this clump and it takes a bite out of the cell to remove it. And that's how we get this very characteristic shape. Here, we have two cells that are basically opposites. Spherocytes are these small, dense little spheres that have lost their central pale area. Why? Because they've lost some of their membrane, which decreases their surface area to volume ratio. Target cells, on the other hand, have too much membrane for their volume, which causes the hemoglobin to pool in the center and give it that classic bullseye or target appearance. And hey, for target cells, we have one of the all-time great mnemonics in medicine. You just have to remember this one phrase: HALT, said the hunter to his target. HALT stands for HBC disease, asplenia, meaning the spleen's been removed, liver disease, and thalassemia. So you see target cells on a smear, you got to run through that HALT list in your head. And finally, we have one of the most recognizable shapes of all, the sickle cell. This crescent or sickle shape is the absolute hallmark of sickle cell anemia. But what's really important to remember are the triggers that cause this to happen. It's things like low oxygen, dehydration, or acidosis. These stressors cause the abnormal hemoglobin S to polymerize and totally deform the cell. All right, detectives, we've thoroughly investigated the outside of the cell. Now it's time to go inside and look for inclusions. Think of these like finding foreign objects at a crime scene. They tell you a ton about what's been going on. First up, Howell-Jolly bodies. These look like a single, small, dark purple dot inside a red blood cell. What are they? Well, they're leftover bits of the nucleus that didn't get cleared out when the red cell was maturing. Normally, the spleen acts like a quality control inspector and plucks these out. So if you see one, it's a dead giveaway that the spleen is either gone or just not working right. It's the classic sign of asplenia.
Next is basophilic stippling. Now, unlike that single, lonely Howell-Jolly body, this looks like fine blue-purple speckles all throughout the cell's cytoplasm. These little dots are actually clumps of ribosomes and RNA. While they aren't super specific, they are a huge clue pointing towards disorders of hemoglobin synthesis, like the thalassemias or sideroblastic anemia.
Okay, let's take a second to clarify 3 important iron-related inclusions because they can be confusing. We've already met Heinz bodies in our bite cell story. Remember, they're just clumps of denatured hemoglobin. And, this is key, you need a special supervital stain to even see them. Pappenheimer bodies, however, are actual granules of iron that you can see on a standard peripheral smear. And finally, if you go to the source, the bone marrow, an excess of iron can form a ring around the nucleus, creating a ringed sideroblast. But you need a special Prussian blue stain to see that. So, we've gathered a whole bunch of individual clues. Now comes the most important part of being a detective, putting all the evidence together. We're going to see how different findings can all point towards a single, unifying diagnosis. This slide shows exactly what I'm talking about. Let's build the case for sideroblastic anemia. So you're looking at the peripheral smear, what might you find? Clue number 1, basophilic stippling. Then you look closer and see another clue, Pappenheimer bodies. Okay, interesting. Then if you were to do a bone marrow biopsy, you'd find the smoking gun, ringed sideroblasts packed with iron granules. You see how clues from different places all converge on one answer? That's how this works. Okay, team, let's wrap this case up with a final, high-yield briefing. This is your rapid review toolkit. This is the stuff you absolutely, positively have to know for your exams and for when you're on the wards. This chart just gives us a quick visual. Really, what it shows is that some clues, like schistocytes and target cells, are linked to a wider range of conditions. That just means your differential diagnosis has to be a little broader. It helps you weigh the significance of every clue you find. And here it is, your quick reference guide for morphology. Let's do a quick fire round. If you see schistocytes, you think MAHA, or mechanical hemolysis. Spherocytes, think hereditary spherocytosis or autoimmune hemolysis. Target cells, you say it with me, HALT. And for those telltale bite cells, you're thinking G6PD deficiency. Perfect. And here's the guide for the clues inside the cell. See Howell-Jolly bodies? The spleen's not working. Heinz bodies, G6PD deficiency, and oxidative damage. And if you see basophilic stippling or Pappenheimer bodies, sideroblastic anemia should be way up on your list. These tables right here are your foundation. So, to wrap this all up, just remember this. The story of a patient's health is so often written right there in their blood. The answers we're looking for are under the microscope, the blood doesn't lie, and by learning to read its language, you're taking the first and most critical step to solving the case for your patient. So I'll just leave you with this final thought. You now have the fundamental tools of a hematology detective. So the next time you look at a peripheral blood smear, don't just see cells. See the clues. Ask yourself, what story is this blood trying to tell me? Thanks so much for